How Tylenol acetaminophen works in your body. Have you ever wondered how a simple tablet can make a pounding headache disappear, ease muscle pain, or bring down a high fever within an hour? Millions of people take Tylenol every single day without giving much thought to what happens after swallowing that small pill. Yet inside your body, an incredible series of biological events begins almost immediately. Your digestive system, bloodstream, liver, brain, and nervous system all work together to activate the medicine and deliver relief where it's needed most. Tylenol, also known by its generic name acetaminophen, is one of the most commonly used medications in the world. It is trusted by doctors, hospitals, and families because it effectively relieves pain and reduces fever when used correctly. Unlike many other pain relievers, Tylenol is gentle on the stomach, making it a preferred option for many people who cannot tolerate medications like ibuprofen or aspirin. But what makes Tylenol unique? Why does it reduce pain and fever so effectively while causing very little stomach irritation? And if it's considered one of the safest medications available, why can taking too much become extremely dangerous? In this video, we're going to take a fascinating journey through the human body to understand exactly how Tylenol works. We'll follow the medicine from the moment it enters your mouth until it reaches your brain, where it changes the way your body experiences pain and controls body temperature. Along the way, we'll also discover why proper dosing is so important and what happens if someone accidentally takes too much. Before we understand how Tylenol works, it's important to first understand what pain actually is. Pain isn't simply something that happens where you're injured. Instead, it's a complex communication system designed to protect your body. Imagine touching a hot stove. Tiny pain receptors in your skin instantly detect the extreme heat. These receptors send electrical signals through your nerves to your spinal cord and finally to your brain. Only after your brain receives and processes those signals do you actually experience the sensation of pain. Pain serves as an alarm system. Without it, we wouldn't know when we're injured, burned, or becoming sick. While pain is incredibly important for survival, sometimes it becomes overwhelming or unnecessary. That's when medications like Tylenol become valuable. Fever works in a similar way. Contrary to what many people believe, fever itself isn't a disease. Instead, it's one of your body's natural defense mechanisms against infection. When bacteria or viruses invade the body, your immune system releases chemical messengers that communicate with the brain. These messengers tell a region called the hypothalamus to increase your body's temperature set point. As your body temperature rises, many disease-causing microorganisms have a harder time surviving and multiplying. At the same time, certain immune cells actually function more efficiently at slightly higher temperatures. So in many cases, fever is actually helping your body fight infection. However, high fever can make you feel miserable. It can cause chills, sweating, body aches, headaches, weakness, and dehydration. That's why medications like Tylenol are commonly used to reduce fever and improve comfort while the immune system continues doing its job. Now let's follow Tylenol from the moment you swallow it. After taking a Tylenol tablet with water, it travels down your esophagus and enters your stomach. Contrary to popular belief, most of the medication isn't absorbed in the stomach itself. Instead, it passes into the small intestine, where the majority of absorption occurs. The small intestine has an enormous surface area covered with tiny finger-like projections called villi. These structures dramatically increase the area available for absorbing nutrients and medications. As Tylenol dissolves, acetaminophen molecules pass through the intestinal wall and enter tiny blood vessels. From there, the medicine enters the bloodstream and begins circulating throughout your body. Because acetaminophen is absorbed relatively quickly, many people begin noticing relief within 30 to 60 minutes after taking a standard dose. But the medicine doesn't simply spread everywhere equally. Instead, it travels through the bloodstream until it reaches the organs where it can perform its intended function. One remarkable feature of acetaminophen is its ability to cross the blood-brain barrier. This protective barrier normally prevents many substances in the bloodstream from entering the brain. However, acetaminophen can pass through this barrier, allowing it to influence pain perception and body temperature regulation directly within the central nervous system. This is one of the reasons Tylenol differs from many other pain relievers. While medications like ibuprofen primarily reduce inflammation throughout the body, Tylenol acts much more strongly within the brain itself. To understand this better, we need to talk about a group of chemicals called prostaglandins. Whenever your body experiences injury or infection, specialized enzymes begin producing prostaglandins. These chemical messengers have several important functions. They help trigger inflammation, increase blood flow to injured tissues, make pain receptors more sensitive, and contribute to fever by signaling the hypothalamus. Think of prostaglandins as volume controls for pain. If you stub your toe, prostaglandins increase the sensitivity of nearby nerve endings. As a result, even gentle pressure on the injured area feels much more painful than usual. This heightened sensitivity helps protect injured tissue by encouraging you to avoid using it until healing occurs. However, it also causes much of the discomfort associated with injuries, headaches, and illness. Tylenol works by reducing the production of certain prostaglandins, especially within the brain and spinal cord. With fewer prostaglandins available, pain signals are not amplified as strongly. The injury itself may still exist, but your brain interprets those signals as less intense. Imagine someone turning down the volume on a loud speaker. The music is still playing, but it's no longer overwhelming. Tylenol performs a similar role inside your nervous system by lowering the intensity of pain perception rather than completely eliminating the source of pain. This explains why Tylenol is highly effective for headaches, toothaches, muscle aches, back pain, arthritis discomfort, menstrual cramps, and many other types of mild to moderate pain. Interestingly, unlike non-steroidal anti-inflammatory drugs, or NSAIDs, Tylenol has very little effect on inflammation outside the brain. That's why it doesn't reduce swelling as effectively as medications like ibuprofen. If your ankle is severely swollen after an injury, ibuprofen may reduce the inflammation more effectively, while Tylenol primarily helps relieve the pain. This difference also explains why Tylenol causes much less stomach irritation. Many NSAIDs block prostaglandins throughout the body, including those that protect the stomach lining. Tylenol acts much more selectively, making stomach ulcers and irritation far less common when it's used appropriately. But pain relief is only half of Tylenol's story. One of its most valuable medical uses is reducing fever, a process that involves one of the body's most important control centers. How Tylenol, acetaminophen, works in your body. Now that we've seen how Tylenol reaches the brain and helps reduce the sensation of pain, let's explore another one of its most important functions, lowering fever. This process is one of the reasons acetaminophen is found in nearly every home medicine cabinet and is commonly recommended for both adults and children. To understand how Tylenol reduces fever, we first need to look at the body's natural thermostat. Deep inside the brain is a small but incredibly important structure called the hypothalamus. Although it's only about the size of an almond, it controls many essential body functions, including hunger, thirst, sleep, hormone release, and body temperature. Think of the hypothalamus as the thermostat in your home. Just as your home's thermostat keeps the indoor temperature within a comfortable range, the hypothalamus constantly monitors your body's temperature and makes adjustments whenever necessary. Under normal conditions, your body maintains a temperature of around 37 degrees Celsius or 98.6 degrees Fahrenheit. This temperature allows your organs, enzymes, and cells to function at their best. Even small changes can affect how efficiently your body works. When harmful bacteria or viruses invade your body, your immune system immediately begins fighting back. White blood cells recognize these foreign invaders and release chemical messengers known as pyrogens. These substances travel through the bloodstream and eventually reach the hypothalamus. Once there, pyrogens stimulate the production of prostaglandins, particularly prostaglandin E2. These prostaglandins essentially tell the hypothalamus that the body's temperature should be higher than normal. It's as if someone secretly turned up the thermostat in your house. Suddenly, your brain believes your normal body temperature is too low. Even though your body may already be at 37 degrees Celsius, the hypothalamus now acts as though you're cold. To raise your temperature, it activates several natural responses. Blood vessels in your skin narrow to reduce heat loss. Your muscles begin shivering to generate extra heat. You may wrap yourself in blankets because you feel chilled, even though your temperature is actually rising. These reactions continue until your body reaches the new, higher temperature set point. That's what we recognize as a fever. Although fever often feels unpleasant, it's actually part of your body's defense system. Many bacteria and viruses reproduce less efficiently at higher temperatures. Fever may also improve the activity of certain immune cells, helping your body fight infection more effectively. However, high fever can also cause headaches, muscle aches, fatigue, dehydration, sweating, and significant discomfort. In children, very high fevers may even increase the risk of febrile seizures. While fever itself is not always dangerous, reducing it can make patients feel much more comfortable. This is where Tylenol steps in. After acetaminophen crosses the blood-brain barrier and reaches the hypothalamus, it reduces the production of prostaglandins involved in raising the body's temperature set point. With fewer prostaglandins available, the hypothalamus recognizes that the body's temperature should return to normal. It's like resetting a thermostat that had been turned up too high. Once the hypothalamus lowers the temperature set point back to normal, your body begins cooling itself naturally. Blood vessels near the surface of the skin widen, allowing more heat to escape into the surrounding air. Sweat glands become more active, and as sweat evaporates from your skin, it carries heat away from the body. At the same time, shivering stops because your brain no longer believes you're cold. As these cooling mechanisms continue, your temperature gradually decreases, and many of the uncomfortable symptoms associated with fever begin to improve. Most people start noticing a reduction in fever within 30 to 60 minutes after taking Tylenol. The full effect usually occurs within 1 to 2 hours, depending on factors such as age, body weight, metabolism, and whether the medication was taken with food. Now let's follow Tylenol on the next stage of its journey. After circulating through the bloodstream and producing its effects in the brain, acetaminophen eventually reaches one of the most important organs involved in processing medications, the liver. The liver acts as your body's chemical processing plant. Every day it filters blood, stores nutrients, produces essential proteins, and breaks down medications and toxins so they can be safely eliminated from the body. When Tylenol enters the liver, most of it is transformed through 2 safe metabolic pathways. In one pathway, the drug combines with sulfate molecules. In another, it combines with glucuronic acid. These chemical reactions make acetaminophen water-soluble, allowing the kidneys to remove it from the bloodstream through urine. For the vast majority of people taking recommended doses, these pathways work efficiently and safely. However, a very small portion of acetaminophen, usually around 5 to 10%, is processed differently. Special liver enzymes convert this small amount into a highly reactive compound called NAPQI, which stands for N-acetyl-P-benzoquinone imine. Unlike regular acetaminophen, NAPQI is toxic to liver cells. Fortunately, your body has an excellent defense system. The liver naturally produces an antioxidant called glutathione. Glutathione quickly binds to NAPQI, neutralizing it before it can damage liver tissue. The harmless byproducts are then eliminated from the body through urine. Under normal circumstances, this protective system works extremely well. That's why millions of people can safely use Tylenol when they follow the recommended dosage. Problems begin only when someone takes too much acetaminophen. If a person consumes a very large dose, the liver's normal processing pathways become overwhelmed. More of the medication is forced into the pathway that produces NAPQI. At the same time, the body's glutathione stores begin to run out. Once glutathione is depleted, toxic NAPQI starts attacking liver cells directly. This can lead to inflammation, cell death, and, in severe cases, acute liver failure. One reason acetaminophen overdose is particularly dangerous is that symptoms may not appear immediately. During the first several hours, a person may experience only mild nausea, vomiting, sweating, or fatigue. Because these symptoms seem minor, some people delay seeking medical care. Meanwhile, significant liver damage may already be developing. If treatment is started early, doctors can administer a medication called N-acetylcysteine, often abbreviated as NAC. This medicine helps replenish glutathione levels, allowing the liver to neutralize toxic NAPQI before irreversible damage occurs. When given promptly, N-acetylcysteine can dramatically reduce the risk of severe liver injury and save lives. Another important factor affecting Tylenol safety is alcohol consumption. Drinking excessive amounts of alcohol regularly can increase the activity of the liver enzymes responsible for producing NAPQI. At the same time, chronic alcohol use may reduce glutathione stores, leaving the liver with less protection against this toxic metabolite. This combination means that people who drink heavily on a regular basis may be more vulnerable to acetaminophen-related liver injury, especially if they exceed the recommended dose or take multiple medications containing acetaminophen without realizing it. For this reason, healthcare providers often advise people with chronic liver disease or heavy alcohol use to consult a physician before using Tylenol regularly. Although all of this may sound concerning, it's important to remember that acetaminophen remains one of the safest and most widely used medications in the world when taken exactly as directed. Millions of doses are used safely every day because the body's natural metabolic systems are remarkably effective at handling recommended amounts. Understanding how the liver processes Tylenol helps explain why following dosage instructions is so important. The difference between a helpful medicine and a harmful overdose often comes down to taking the right amount at the right time. In the final part of this series, we'll explore the correct dosage guidelines for adults and children, common side effects, drug interactions, signs of overdose, emergency treatment, and practical tips for using Tylenol safely and effectively.